Carolyn Vandyken here from Reframe Rehab. I want to talk to you today a little bit about Anthony Lowe's course, Reframe Rectus Diastasis. Anthony's a wonderful instructor that really helps us to break down complex information into easy, digestible pieces. One of Anthony's strengths in teaching is to come up with acronyms that help us to really understand the material. And one of the acronyms that I really love that he uses is called BAMS. And Anthony tells us to look at our beliefs, our attitudes, the meaning behind kind of the information that we see with our patients, and the story that we tell ourselves and the story that our patient tells themselves about what's going on. And when we look at that with rectus diastasis, it allows us to actually reframe rectus diastasis. So again, what are our beliefs? Certainly in 20 years of pelvic health physiotherapy, I had a long-standing belief that we needed to correct the gap by doing a rectus abdominis sort of head lift with pulling the towel ends together. And then that switched to thinking about the transverse abdominis a little bit more. And after taking Anthony's course, I really started to challenge some of those core beliefs and said, I wonder if we really have to go back and think about the rectus abdominis again, but very much from a functional perspective. But he also asks us to look at our attitude and the meaning that we give problems like rectus diastasis. Are we the barrier that our patients have to fight against? So in other words, are our beliefs and our restrictive attitudes around return to exercise with the rectus diastasis part of the problem? And what is the story our patient is telling themselves, and how much of that is based in science and in good evidence, and how much of that is just based on a lot of information that's going around the internet at this point? So in this particular course, Anthony has an all-star crowd. He has a number of pelvic health clinicians who have significant expertise in this area of rectus diastasis from around the world. And he really just gives us permission to get our patients moving again. He really looks at the evidence critically and says, let's help our patients become functional. So if you want to start to challenge your beliefs around rectus diastasis and really look at the evidence and the biomechanics in a very biopsychosocial framework, I would highly recommend this course.